Much like going up against a Thunderjaw in Horizon Forbidden West, it takes finesse for game developers to successfully incorporate topics of mental health into a AAA video game. Horizon Forbidden West is one game that manages to successfully touch on delicate themes such as mental and physical health, while always staying true to the time, culture, and people that inhabit the world of Horizon. In this video, we'll walk through the mid-game side quest In the Fog to demonstrate how the developers at Guerrilla Games artfully and respectfully represented a character with a real-life illness while staying true to the culture, time, and society of the game world that they created. Before we do, I want to thank you for watching Digital Games, the channel all about games and health. To best support the channel and give me a nice serotonin rush, please hit that like button and subscribe to the channel. We're first introduced to the In the Fog mission at Tide's Reach, where a young woman named Phaneira is recovering from her recent injuries from a disagreement turned violent with her father, Garrokah. Phaneira tells Aloy that her father has recently been sneaking out of the village to hunt, sometimes gone for days without telling anyone his whereabouts. When Phaneira followed her father, she tried to convince him to come home, and in response, he fought with her, eventually nearly killing her with his knife. However, Phaneira is less concerned with her wounds than she is of why her father could have done this to her.
It doesn't make any sense. The way he looked at me. It was like I was a stranger.
Astute observers or the clinically minded may already be able to start forming a diagnosis for Garrokah even without ever having met him. This highlights the importance of obtaining a good patient history in the clinical setting. Much like a detective, a doctor has to use all of the information at their disposal to piece together what is going on with a patient. A patient's physical exam, environment, what they say, don't say, and a patient's subtle and not so subtle behaviors all have to be taken into consideration when forming a diagnosis. And oftentimes, the most valuable information may come not from the patient, but from the people who know the patient best, like their loved ones, like Phaneira. In this case, before we even meet Garrokah, we are already provided with the information that he has been running off, has been aggressive and violent, and clearly confused and forgetful. Furthermore, this has been going on for a while, with bouts of confusion happening off and on again. Given this, and Garrokah's older age, it's likely we are dealing with a person struggling with some form of dementia or cognitive impairment. Horizon Forbidden West presents this information to the player in a very similar way to how a patient's family member might seek out help from a physician. When we finally get to Garrokah's camp, we follow his trail to find him in the midst of the hunt against a herd of machines. But Garrokah does not initially come across as the typical frail, fragile patient that we might imagine when envisioning someone with dementia. Garrokah is strong, capable, and driven to rescue his comrades who he says are in danger deeper in the forest. However, as Aloy follows Garrokah to aid in his rescue mission, his comments on the nature of his mission call his mental state into question. While Garrokah seems strong-willed and confident, his recollection of events is off. He reports recent tribal conflicts occurring in the woods, although that story does not add up with the recent history of the land that Aloy knows to be true, where the tribes have lived in peace for years. When machine stalkers ambush them on their way, Garrokah first calls out in warning that an old rival clan, the Sky Clan, is attacking, despite the fact that the conflict with the Sky Clan ended years ago. Garrokah's persistent belief of past events occurring in present day, despite evidence that they are in fact not occurring, is significant for persistent delusions, another neuropsychiatric symptom, much like aggression, common in dementia. Neuropsychiatric symptoms are observed in 60 to 90% of patients with dementia, and are often the reason families first express concern to a physician, because that patient is now acting violent, strange, or perhaps inexplicably running off. Furthermore, these behavioral disturbances commonly peak in the late afternoon or evening, a phenomenon known as sundowning. This makes sense since Phaneira told Aloy that Garrokah has been running off often at nighttime. In my experience treating more severely demented patients in the hospital, many of them would become paranoid, agitated, or aggressive at night. Some would forget who, where, or when they are, which is why the first questions a physician generally asks someone when doing a cognitive assessment is who are you, where are you, what date is it, and what is going on.
I was so sure they were... Never mind.
Garrokah would probably be A and O times 2, meaning he is alert and oriented to person and place, but not to time and situation. The most interesting thing to me about treating a patient with delusions is the fixed aspect of those delusions. Common delusions include feeling that someone or something is after you, feeling that family members have been replaced by imposters, or that devices have been implanted inside of you. It is not the job of the physician to dispel these beliefs. After all, these beliefs are very real to the patient. Instead, physicians and caregivers should acknowledge and validate the patient's perception of reality, or, if they are particularly distressed, find a way to reassure them that they are safe. Aloy at no point tries to shake Garrokah out of it, or change his false belief. Instead, she accompanies Garrokah on his quest and makes sure he stays safe. It is only when Garrokah finds a memorial for the fallen soldiers he was rushing out to save that Garrokah himself is forced to confront his delusion and be brought out of it. This is not always typical of delusions, which are characterized by their persistence, even despite clear evidence of their falsehood. However, it is possible Garrokah's dementia is less severe, or that his sundowning was wearing off, and he was slowly beginning to return to a regular mental state. Spatial memories can also be quite powerful, so perhaps being in the exact location where Garrokah's squad was ambushed was enough to have him finally come out of it. Either way, Aloy and Garrokah are finally able to have a conversation, where Garrokah acknowledges his ailment. He says everything feels like a fog, a typical description for what it feels like to have dementia. We see the confusion, discomfort, and pain on Garrokah's face, almost as real and convincing than any patient I have treated in the hospital. Garrokah looks around his environment, saying he feels always alone in the forest, a point that is as literal as it is figurative. When we finally get back to Tide's Reach, Aloy delivers the news to Phaneira about Garrokah's condition. Phaneira and her friend piece together that Garrokah's condition seems to be similar to what some chaplains, an appointed group of elders dedicated to teaching new generations, experienced. Since the Tanakh tribe has only known war for so long, it was unusual for anyone other than chaplains to live to be so old. But now that they survive in a time of peace, they can experience age and the ailments that come with it. But this news is comforting to Phaneira, who now knows that her father's condition is an ailment due to age, and not due to being deranged or insane, a state that, according to Tanakh law, is cause for execution. Reunited at last, Phaneira embraces her father and promises to take care of him and hold his hand through the fog, a responsibility that is in no way light or easy, but now, equipped with the proper knowledge of what is happening with her father, may even create an opportunity to discover a new way to relate to her father and bring back value to a relationship that was once lost.
It's all right, Father. You're home safe. And I understand now. When the fog comes, I'll hold your hand tight and remember for you. You don't have to be afraid.
With the side quest In the Fog, Guerrilla Games laid out a story that feels right for a tribe who knows little about health and illness, and the steps in which the diagnosis of dementia was revealed felt true to the people, culture, and time that the story of Horizon Forbidden West is set in. It is a great example of using the unique medium of video games to not only portray mental health or illness in a respectful way while still staying true to the game world, but to use the immersive nature of games to give the player a deeper understanding of what illness may look like or even feel like, making us walk away from the game as more understanding and empathetic gamers. Thanks so much for watching the video. What are your thoughts about using video games to portray serious topics like mental health? How does Horizon handle this compared to other games you've played? You've heard my thoughts, but now I want to hear yours, so please do leave a comment below and I'd be happy to respond. If you like this one, please consider liking this video, and remember, for everything games and health, subscribe to Digital Doc Games.